Bismillahirrahmanirrahim. Various factors influence the tissue repair, and these are discussed in this video. Several key factors influence tissue repair, affecting both the rate and quality of the healing. These are broadly divided into local and systemic factors, and understanding them is essential for predicting outcome and optimizing care. The local factors that are present at the site of the injury are infection. These are the most important local cause of delayed healing. They prolong inflammation and increases tissue injury. Then mechanical stress or repeated movement at the site of the infection or damage disrupt newly formed tissue, and granulation tissue can lead to wound dehiscence, that is the reopening of the wound. Foreign bodies such as splinters, sutures, or glass can cause chronic inflammation and impair repair. The adequate blood supply is essential for the delivering nutrients, oxygen, and cells to the area. Poor perfusion, for example, in diabetes or atherosclerosis, impairs healing. Size, location, and type of the wound are also important. Smaller, cleaner wounds heal faster, while highly vascular areas such as face heal better than poorly vascularized areas such as tendon. Tissue type and extent of injury, uh, example, full restoration occur only in tissue with stable or labile cell, and permanent cell lead to scarring and functional losses. Sometimes inflammation in the tissue spaces such as pleural, peritoneal, and synovial may resolve via exudate digestion, that is termed as resolution, or form a fibrous scar through granulation tissue, that is termed as organization. The systemic factors affect whole body, and one of the systemic factor is nutrition, in which protein deficiency slows the synthesis of the collagen. Vitamin C is critical for collagen hydroxylation and cross-linking, so deficiency of vitamin C also lead to delayed healing. Diabetes mellitus impairs inflammation, angiogenesis, and collagen deposition. The poor perfusion, as happens in shock or congestive cardiac failure, reduces nutrient and oxygen delivery. Glucocorticoid or corticosteroid inhibit transforming growth factor beta production and reduce inflammation, can impair collagen synthesis and fibrosis. Elderly patients have slower cell turnover and reduced vascular response and thinner skin. Then immune status is also important. An immunocompromised individual may have impaired healing and increased risks of infection. There are some pathological conditions that alter repair, such as chronic inflammation, fibrosis, keloid, hypertrophic scar, and non-healing ulcer, as happen in diabetes, venous stasis, or are the outcome uh, of the disrupted or dysregulated repair. Thank you for watching this video. If you have any question, please write in the comment box.